I'm going to do enteral tube feeding now, and what I'm going to do is come in the room, introduce myself to the patient, perform hand hygiene, and then provide privacy, and then put on my gloves. Once my gloves are on, then I'm going to auscultate for vowel sounds. And then I'm going to check for tube placement. The first thing I'm going to do is withdraw some stomach contents and test the pH. And then I'm going to insert 20 mLs of air. And while I'm doing that, I'm going to be listening to the epigastric region and make sure that I'm hearing gurgling. Okay, that's good. Pause. Because I should have. Okay, and now I'm going to aspirate the stomach contents and see how much is left from the feeding previously. If there's more than 100 mLs, what I would do is just replace it back into the stomach and wait an hour and then come back. So I'm replacing whatever was left and then making sure that I document that. And then I'm going to flush the line with 20 mLs or 30 mLs of water or normal saline, and then clamp my tube. At this point, put this to the side. I'm going to grab my formula. I'm checking for the expiration and the temperature of the formula and making sure that it's within date range. And then per my orders, I'm going to pour the amount that I need into here. Okay. And then allow the tube feeding to go. If the patient can't tolerate the amount of volume that's going in, I can lower it to decrease or to increase the time. Okay. And then I'm going to flush the line with 30 mLs of water. After every installation of either a tube feeding or medication, the line needs to be flushed with 30 mLs of water. I'm going to keep the patient head of the bed elevated at this angle for an hour. And then after the placement has been done, I will remove my syringe, and then I'm going to document how the patient tolerated the procedure, how much formula was instilled, and the date and the time. Ready? Okay, so if I was using a pump feeding instead of a manual feeding, I would connect my pump to the IV line and calculate my drip rate factor. The only thing differently would be that it's a controlled factor instead of like a bolus feeding, but everything else is the same.